Have you or someone you know ever faced an expensive hospital bill? Or been told your insurance doesn't cover certain treatments? You're not alone. Right now, Malaysia's healthcare system is struggling and it affects everyone. Let's start with the basics. Healthcare costs in Malaysia are going up much faster than in many other countries. Medical inflation, basically how fast treatment costs rise, is expected to hit nearly 13% this year. That means hospitals have to spend a lot more on things like imported medicines, high-tech machines, and salaries to keep doctors here instead of overseas. Private hospitals are also under pressure. Not only do they earn profits of about 7 to 11%, but they also reinvest most of that money into maintaining facilities, purchasing new equipment, and compensating qualified staff. And that's just part of the puzzle.
The demand side, as you know, increasing in the population that are aged is one of the important factors. And then the prevalence of chronic non-communicable diseases. So all these actually require huge amount of resources in the long term for treatment. The supply side, one of the important aspects is that how the development in terms of the technology. So we know there are a lot of new technologies available now. We have special equipment, a special way of treating, or new drugs that we use which are very expensive.
Because private care is expensive, many people rely on public hospitals. But these hospitals are overwhelmed. Over 70% of Malaysians depend on them. Some doctors have to care for more than 1,500 patients each, leading to long waiting times and stressed staff. So what about insurance? Many people think hospitals charge more if you have insurance, but that's not really how it works. Hospitals actually charge the same base prices whether you pay cash or use insurance. What changes is that insurance companies often negotiate discounts with hospitals if they send a lot of patients there. That's why some insured patients may pay less, not because hospitals charge differently, but because insurers negotiate volume-based discounts. At the same time, self-paying patients can also end up with lower bills, often due to package deals, upfront payments, or discounts offered on a case-by-case basis by doctors or hospitals. However, insurance doesn't always cover everything. Some policies, especially older or more basic ones, may only cover the first occurrence of a serious illness like cancer. When a condition recurs or policy limits are reached, patients often end up paying out of pocket or turning to the public system for continued care. Meanwhile, insurance premiums, the monthly or yearly amounts you pay, are shooting up. Some people have seen their premiums go up by 50% in 3 years, even though the official limit is supposed to be 10% a year. And many don't know exactly what's included in their policies. In May, the government told clinics, private hospitals, and pharmacies they have to publicly display medicine prices so people can see what they're paying for. It sounds like a good idea, but doctors worry it could turn consultations into bargaining sessions instead of focusing on what treatment is best. And with the threat of fines reaching up to 100,000 ringgit for non-compliance, clinics, private hospitals, and pharmacies fear these new requirements could push them closer to financial strain, limiting their ability to invest in better care for patients.
They also have no choice. They face a lot of headwinds. We do believe that. And because we've got the tariff problem, we've got our poor currency exchange, there's a lot there that will cause the problems that will trickle down to the Malaysian public.
The result? People who can't afford private care or whose insurance runs out end up crowding into public hospitals. This puts even more pressure on government doctors and nurses who are already stretched thin. And as medical costs keep rising, fewer Malaysians will be able to afford insurance at all. Experts say regulation of the insurance industry is needed to keep the system sustainable.
When the bottom line is the most important objective, it will be to the detriment of the public. So we need some sort of regulation. We know that the medical doctors are the ones who are being regulated. Our fees have not changed for the last decade.
And while doctors are earning less of the healthcare ringgit spent, patients are also feeling the squeeze, especially as insurance premiums and out-of-pocket costs continue to climb. But they also warn against rushing into new rules. Too many changes too fast could make private care unprofitable, which would leave public hospitals even more overcrowded. What Malaysia needs is a balanced approach.
There's almost always a third way, almost always a middle way, almost always a consensus decision. So collaboration between stakeholders is very important.
Any real fix must start with the system most Malaysians rely on. With over 70% depending on public hospitals and doctors already stretched thin, it's clear that no reform can work without strengthening the backbone of our healthcare. One way the government is addressing this is through the recent formation of the Joint Ministerial Committee on Private Healthcare Costs, bringing together public, private, and insurance stakeholders to work toward a balanced, long-term solution for medical inflation. Malaysia's healthcare crisis affects every one of us. But by improving transparency, regulating insurance fairly, and working together, we can build a system where everyone, no matter their income, has a chance to get the care they need. Narmtha Raja, FMT.